Ladies and gentlemen, welcome to the return of our video lecture series on the wonderful, the wide world of psychology. So you guys are getting videos from me over the next few days, tonight, over the weekend, and a few days next week. And these videos will cover what we might call abnormal behavior, which is sort of a nicer, more, I guess you might say, politically correct way of saying psychological disorders, mental illness, when things go wrong in your brain and in your body that result in psychological disorders. Some notes, this was mentioned in class, but just a reminder, your reading guide is not going to be the most useful note-taking tool for you on these, and I will discuss why on that a little bit later in this video, actually. So if you want to use your best friend to help you out a little bit, you can feel free to do so, but just know that some of the info in your best friend about this particular unit is actually wrong. It is incorrect. So if there is a contradiction between what you hear in a video and what your best friend says, you need to go with what is discussed in the video. Again, I'm going to explain that to you in a second. Here we go. This first section, this first video, we're not going to talk about any specific disorders in great detail. Instead, we're going to sort of talk about the overview, how psychologists think about disorders and how they determine what is a disorder, how they classify a disorder, so on and so forth. As always, I'm giving you key vocab at the start of each video. So there's your key vocab, only 3 terms, nice and easy to start you off in this first video. Let's get after it. So how do we define disorders? This is a question that has come up frequently throughout psychology, and our answer for it now might not be the same thing we say a decade from now, or 2 decades from now, or certainly 50 or 100 years from now. It's likely to change. But right now, according to the American Psychological Association, which is the sort of governing body in the world of psychology, a disorder is a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. And each of those is important and sort of individually stands on its own. So let's break down that definition a little bit. First, we have it's clinically significant. And you'll recall that when we talk about clinically, we're talking about medicine. We're talking about treatment. Okay, so this is something that is judged significant from a medical standpoint. It's a disturbance in an individual's cognition, and when you think cognition, you're thinking about thoughts. Their emotional regulation, that means how well they manage, control, maintain their emotions. Someone who has good emotional regulation handles their emotions very well. If you have a friend who is always getting emotional, always crying, so on and so forth, they might have a little bit less off emotional regulation. That does not mean they have a disorder. They're just not so great at emotional regulation. And the last one is behavior, straightforward, how you behave. An important note, disturbed behaviors, and that's what we will call these, behaviors that are sort of dealing with disorders are disturbed, quote unquote. They are maladaptive. That means they interfere with day-to-day life. We all have weird things that we do. We all have strange habits, so on and so forth. Those do not tell us that we have a disorder unless they are interfering with our functioning in our day-to-day lives. And if we have to drastically change what we're doing day-to-day, that is when a behavior becomes maladaptive. Another important note, as I said, this definition is subject to change, and it has changed over time. A good example of this is homosexuality. For a long time, the American Psychological Association included homosexuality in its list of psychological disorders. And it wasn't until fairly recently, I believe it was actually the 90s, that gay and lesbian psychologists and their allies in the community got the APA to overturn this and be like, look, this is no good. We can't call homosexuality a disorder. It's just a way of being. It's your sexual orientation. They're 2 totally different things. That wasn't medically documented and scientifically agreed to until somewhat recently in history. And again, This classification is still debated today. The disorder ADHD is an excellent example. ADHD, as many of you probably know, stands for attention deficit and hyperactive disorder. Stereotypically, it is found in young children who are super hyper, and they are maybe the behavior problems in their third grade classroom. They are bouncing off the walls all the time. They can't focus. That's ADHD. But in the decade between 1987 and 1997, diagnoses of this disorder quadrupled. That means they grew by 400% in just that decade. And so when something like that happens, it gives psychologists pause. They stop, they ask themselves, why might this be happening? There are some other things that also gave people cause for concern. For example, if you look at the symptoms of ADHD, African American children are much more likely to demonstrate those symptoms, but are much less likely to actually be diagnosed with ADHD than white children are. So this tells us that there might be some cultural perceptions at play here, some potentially social stereotypes, what have you, some other things that might be affecting the actual execution of these diagnoses. So ADHD is treated with a variety of therapies, and commonly is treated with medication. We talked about the issues surrounding medication earlier this week. So Ritalin, Adderall, so on and so forth. Many of you are probably familiar with them. Those are what are used to treat ADHD. Many psychologists feel, and we can include Tom Cruise in this, even though he's not a psychologist, that these medications are over-prescribed. And in fact, it is not outside the realm of, it's not rare, I guess I should say, for affluent parents to seek out these diagnoses for their children because they might help their children get a leg up, whether it be in giving them more time to take an important test like the ACT, giving them a little extra attention in school. I just speaking from experience, where I grew up in the suburbs, there were some parents who would try to get their children diagnosed with ADHD so that they could get some of these quote unquote benefits. So again, this is an issue that is debated and discussed. Do these children really have ADHD, or are they just more energetic? There's not really a consensus answer on that in the psychological community just yet. So before we get further into disorders themselves, let's look back at the history of mental illness and of mental illness treatment, and how our thinking about that as a society has changed over time. The concept of mental illness and issues sort of kind of first reared its head in real substantial ways, sort of close to the modern way of thinking about it in the Middle Ages. So we're talking Europe, 12 to 1500 roughly, so many centuries ago. But in the Middle Ages, if someone was mentally ill, if they were quote unquote crazy, it was believed that they were possessed by a demon. People who were deemed mad were put in cages, and they were given quote unquote therapies, and those therapies could include things like torture, things like burning at the stake, which you see on the left here. This is a woman being burnt at the stake in the Middle Ages in the town square, and some other less nice things. It obviously was not sort of positive for any patient to be deemed quote unquote mad. This really started to change an inflection point in the debate, and our social thinking around mental illness came in the early 1800s when a French dude named Pinel began to think, you know, look, let's pump the brakes here for a sec. These people need our help. They are not you know, some evil mad person that we need to punish or eliminate. They need help. They need medical treatment, just like you need medical treatment if you become physically sick. And he started the ball rolling in sort of what became our more modern thinking about mental illness and the treatment of it. It didn't happen right away, of course. If you've seen the movie Shutter Island, or if you watched the season of American Horror Story that dealt with the asylum, you've seen a little bit of a stereotypical view of an asylum. This is an actual picture of an American insane asylum from, I believe, the 60s. And in the mid 20th century, so mid 1900s, this was what happened with people who were deemed quote unquote crazy. Patients who were mentally ill were put in asylums, which were meant to be treatment facilities, hospitals for the mentally ill, but often ended up actually being very deplorable living conditions with poor treatment for these poor men and women. You can see they're mostly men here who were put in these facilities. There's a reason that a show like American Horror Story, a movie like Shutter Island, can use this sort of stereotype as asylums as scary, dark, dirty, dangerous places, is because some of that was true for a lot of our history. Obviously, this is not a healthy way to treat someone, especially someone who's in need of real medical care. Asylums started to be phased out in the 70s and 80s, and we began moving more towards this sort of, we have a psychiatric ward of a hospital, which is like what we have more like today. So moving in again towards our more modern conception of how to treat disorders. Today we have a few different ways of thinking about treating disorders and understanding disorders. The first is the medical model. And it's useful to think about the medical model as movements from one line of thinking to another line of thinking. This line of thinking on the right is actually what the medical model calls for. So we're moving from thinking about mental disease. This is mental, something that is wrong with certain numbers of people. You know, you have a mental disease, to mental health. And this is more comprehensive. This applies to everyone, even if everyone should be thinking about their mental health just like they think about their physical health, not just if you have a disorder. We're moving from religious or just unscientific explanations, like, for example, thinking people are possessed by demons, to diagnosing observable, clinically documented symptoms of specific disorders. And we'll look at the symptoms of different disorders as we finish off this unit. Again, moving from punishing the person to giving them medical treatment, whether that be through a therapy that we've talked about last week, through pharmaceuticals, and usually a combination of those, the eclectic approach. And of course, how do we treat that person? We don't imprison them. We get them with a doctor, with nurses, with a team of physicians and psychiatrists who are clinically trained to help them out, to make their life better. Second way of thinking about disorders and how you can understand them is the biopsychosocial approach, our old friend. You've got, as we will talk about with specific disorders, there's usually biological reasons relating to your genes, relating to things going on with your brain. We'll see that different people with different disorders have different structural issues with lobes of their brain, and with different, the limbic system, for example, might be too small or too big. That is real, and that impacts someone's behavior, obviously. Psychological influences as well. Stress is a huge one, and trauma is another huge one. We're going to talk about both of those in relation to several different disorders. If you are super stressed, or if you undergo a traumatic event, that can be the key that unlocks a psychological disorder in you. And there's social and cultural things that play into this as well. What do we think about as normal and as different? If you think about that for a sec, our conceptions of what is normal, what is different, will influence how we determine what a maladaptive behavior is. With that being said, there are also different sort of ways of thinking about disorders in different cultures. In Latin America, you have susto. In Malaysia, you have amok, I think I said that right, which is like super aggressive and violent behavior. Social anxiety, I'm not even going to try to pronounce that, in Japan. And this hikokomori, which is social withdrawal and basically retreating within yourself, which also happens in Japan. One note about that is there are some disorders that are diagnosed and treated and documented across cultures. Two big ones are depression and schizophrenia. You'll see those across the world, around the globe. How do we classify disorders? How do we know if you have a disorder? For that, the Bible of psychological disorders, the big book, is the Diagnostic and Statistical Manual of mental disorders, which you can abbreviate as the DSM. There have been 5 big versions of this, the original one, and then 4 rewrites. And this is, again, put out by the American Psychiatric Association. The most current one came out a few years ago. That's the DSM-5, and that is what we are using. That is what I'm basing all of these lectures to you off of. The reason why you cannot use your best friend for this to help you out with these lectures is that your best friend was written and produced when the DSM-4 was still the text of record. The DSM-5 had not come out yet when your best friend was published. So the DSM-5 revised and changed how certain disorders are diagnosed. And for that reason, it is not, your best friend is not very useful as we work through this, because it is out of date. It's like if an old textbook had an old map of the world that had countries that don't exist on it anymore. It's the same deal. So the DSM contains, like I said, criteria for diagnosing each specific mental disorder. It will name the disorder, and it will say if a patient has these symptoms, they have this disorder. And again, these have changed recently. We're going to continue thinking about sort of how the DSM is written and some implications for that process down the road. One other note it's important to think about as we move through, labeling, which is what we call this process of identifying someone having a psychological disorder, can have some real consequences for people. It can change the way when someone is labeled as having a disorder, it can change the way you view them, and it can change the way they view themselves. So for example, there was one study that was done where people were shown videotaped behavior. So they were basically shown a video clip of someone behaving in a certain way, doing something, whatever. If the people watching the videotape were told before they started watching that the people they were watching, the people in the videotape, had been diagnosed with a mental disorder, they were much more likely to think that the behavior they saw in the video was not normal. So the people who were not told, the control group who was told that they were not told that the people they were watching had a mental disorder, they were much more likely to say, yeah, that's normal behavior. So this, having just this label in their mind, changes the way people perceive others and others' behavior. In addition, there's a lot of survey evidence that shows that if you have been diagnosed with a psychological disorder, it can cause a serious barrier for you in getting a job. A lot of employers just don't want to hire someone who is open about having a psychological disorder because of cultural stereotypes and biases about it. This is changing in some ways, but interestingly, only for gender atypical disorders. And here's what I mean by that. We'll see as we move through our unit that some disorders affect one gender more than the other. The only disorders that are sort of becoming widely accepted and, for example, won't hurt you on the job hunt are disorders that affect both genders equally. So for example, depression, generally speaking, affects both genders equally. So it is sort of it's not taboo anymore to have depression for the most part. It won't hurt you with most employers. But schizophrenia affects men much more than women. So it is still, having schizophrenia is still very likely to affect you on the job hunt. Even beyond that, as you guys all know, there are still many stereotypes of those with mental illness. You've got the Joker here as one stereotype, just crazy, hyper behavior, serial killer, just completely unhinged. That's our stereotype of a person with a mental disorder. In reality, really, that's not really what we're talking about when we talk about people with disorders, but it is still the stereotype that is fed, over and over by scary movies, so on and so forth. That is it for our first video. Make sure you answer the question that is on Google Classroom, and we will see you back for a little bit more tomorrow. Thanks very much.